Hi, Dr. McCarthy again, and today we're going to talk about thyroid treatment success secret number 11. Today we're going to talk about blood sugar. And many people have had their blood sugar checked by their traditional healthcare provider, and they say, oh, I've had mine checked, it's fine. The lab says the normal range is 70 to 105, a very broad range. If you go above 105, 126, 106, up to 126, that can be termed pre-diabetes. And then if you go above 126, that's when you could be classified as having diabetes. What's most important to remember, though, is that the lab ranges are very broad. We use a much narrower optimal range. In our testing, we want to see your blood work come out between 85 and 99. But you've got to remember, this has got to be a fasting test. Many times, people will go to their doctor to get their blood work done, and they fasted for 6 hours, or they slugged down a cup of coffee on the way in. That's unacceptable. You've got to learn how to do this the right way. In our office, we are very strict. Before we send someone out for blood work, we explain to them exactly what they need to do, what they have to do, and what they cannot do. It's very important. If you're going to take the time to run these tests, please run them the right way. So again, the condition that we're talking about now with blood sugar dysregulation means normal is 85 to 99. Typically, we'll see people with symptoms where their blood sugar goes down below 85 and then up above 99, and below 85 and up above 99, all throughout the course of the day. They're on this blood sugar roller coaster. What we call that is not diabetes, but we call that dysglycemia, going too high and too low throughout the course of the day. That is terrible for your health. There's absolutely no way that we can help your thyroid gland function properly if this is the way you're going to continue to live your life. We teach all of our patients how to eat properly so that their blood sugar is gentle rolling hills instead of wildly fluctuating roller coaster rides. Remember, your brain needs fuel and activation. The activation is movement, the exercise, treatments that we do neurologically here in our office, but the fuel comes in the form of glucose and oxygen. The oxygen we covered in a previous video on anemia, and now we're going to talk about the blood sugar, the form of glucose. The food that you eat can get turned into glucose in your bloodstream to provide energy to all the cells in your body. What happens is, you'll eat the food, the glucose, and it gets converted into triglycerides for fat storage. And if you're eating high amounts of carbohydrates and it makes you tired, that's a bad situation. If you get sleepy after eating that, then we know that you've got dysglycemia. You've got to watch what you're eating. We tell you exactly what to eat and when to eat to keep that normal blood sugar. Then the last thing we talk about, all of our patients, people will wake up in the morning and either they're not hungry, so they won't eat breakfast, or the breakfast will consist of high carbohydrates, which is basically plowing down the sugar. Carbohydrates get turned into glucose, triglycerides, and then plowed away for fat storage. You can't eat that way. When you're eating your sugar, your carbohydrates, you've got to include protein. So protein will prevent that sharp spike of blood sugar and create a long-lasting surge to keep your energy levels normal. If you have issues, you think you've got issues with your blood sugar, and you want to know for certain how to handle these problems, call my office now, and we'll get you tested properly, and we'll figure out what's going on. Don't suffer another minute. Thanks.